If you are over 60 and your ankles swell by evening, your socks leave deep marks, or your feet feel tight in your shoes, don't ignore it. In the next few minutes, I'll show you 5 common causes of swollen ankles, why this may be happening, and what you can safely try at home. Stay with me until the end, because I'll also show you when swollen ankles are not just a home problem and may need urgent medical care. Many people notice it first at night. You take off your socks, and there is a clear ring around your ankle. Your shoes felt normal in the morning, but by dinner they feel too tight. Maybe your legs feel heavy when you stand up from the chair. Maybe your feet look puffy, shiny, or bigger than usual. You press your finger near the ankle, and the skin stays dented for a few seconds. You're watching Dr. Wellness, where we explain simple health habits for seniors in plain English. And if this kind of simple health explanation helps you, like this video, subscribe to Dr. Wellness, and comment below with your age or the symptom you notice most. Do your socks leave marks? Do your feet swell? Do your legs feel heavy by evening? Now here is the most important thing to understand. Swollen ankles after 60 may not be just old age, and it may not be only from eating too much salt. Salt can play a part, yes, but ankle swelling can also be linked to circulation, heart strain, kidney problems, liver problems, certain medicines, weak leg veins, long sitting, or even a blood clot. Some causes are mild, some need a doctor, and a few should never be ignored. Think of the veins in your legs like one-way roads with little gates. Blood has to travel from your feet back up toward your heart. Those little gates help stop blood from falling backwards. When you walk, your calf muscles squeeze and help push blood upward. But after 60, those gates may become weaker, the muscles may not squeeze as strongly, and sitting too long can slow everything down. When blood and fluid do not move upward well, fluid can collect around the ankles. That is why swelling often looks worse at the end of the day. The first common cause is weak leg circulation from the veins. Doctors may call this venous insufficiency. That simply means the veins in the legs are not moving blood back up as well as they should. This is very common as people get older. You may notice swelling in both ankles, heaviness in the legs, aching, itching, dry skin, or visible blue veins. The swelling may be better in the morning after your legs have been flat all night, then worse in the evening after standing or sitting. This matters after 60 because the legs have had many years of pressure from standing, walking, weight changes, injuries, and daily life. The tiny gates inside the veins may not close as tightly. When that happens, fluid can slowly build up around the lower legs and ankles. A safe thing to try is gentle movement during the day. Do not sit still for hours. Every 30 to 60 minutes, move your ankles up and down, slowly circle your feet, or walk around the room for 1 or 2 minutes. When you are resting, raise your legs so your feet are above the level of your heart if you can do so comfortably. This may help fluid move back toward the body. But do not force your legs into a painful position. And if your doctor has told you that you have poor artery blood flow, or if your feet are very cold, blue, painful, or numb, ask before using compression socks. Stay with me, because the next cause is one many seniors blame on aging, when it may actually be a daily habit that can be changed. The second common cause is long sitting or long standing. Many seniors sit for long periods without noticing it. You may sit at breakfast, then sit while watching television, then sit again in the car, then sit in a waiting room, then sit again after dinner. Even if you are not sick, sitting still can allow fluid to settle in the lower legs. Standing in one place for too long can do the same thing. This happens because gravity pulls fluid downward. When you move, your leg muscles help push fluid upward. But when your legs stay still, that natural pump is quiet. The ankles are at the bottom, so they often show the swelling first. This is why some people say, "My ankles are fine in the morning, but by evening they look swollen." The day itself can pull fluid downward, especially if you have been sitting with your feet on the floor for many hours. A simple safe habit is the 1-minute leg reset. While sitting, keep both feet flat on the floor. Lift your heels and lower them slowly 10 times, then lift your toes and lower them slowly 10 times. Then straighten one knee gently, hold for 2 seconds, and lower it. Do the other side. This should feel easy. Do not hold your breath. Do not rush. Stop if you feel pain, dizziness, chest pressure, or shortness of breath. Another helpful habit is to avoid crossing your legs for long periods. Crossing the legs can add pressure behind the knees and may make fluid movement harder. Also check your socks. Very tight sock bands can leave deep marks and may make swelling look worse. Choose soft socks that do not cut into the skin. But swollen ankles are not always about movement. The next cause is hiding in many kitchens, and it can make the body hold on to extra fluid without you realizing it. The third common cause is too much sodium, which is the salt hidden in many foods. Sodium is not only in the salt shaker, it is often in canned soups, packaged snacks, frozen meals, deli meats, pickles, sauces, instant noodles, chips, and restaurant food. After 60, the body may not handle extra salt as easily, especially if there are heart, kidney, or blood pressure problems. When you eat a salty meal, your body may hold on to more water. That extra water can show up as swelling in the ankles, feet, fingers, or even around the eyes. Some people notice that their ankles swell more after a salty dinner, a restaurant meal, or a day of processed foods. This does not mean you should stop eating all salt suddenly. The body needs some sodium, and some people, especially those on certain medicines or with certain medical conditions, need personal advice. But many seniors can support healthier fluid balance by reducing heavily processed salty foods and choosing more fresh, simple meals when possible. Try this for the next 7 days. Notice whether your swelling is worse after high-salt meals. Look at food labels. Choose lower sodium options when you can. Rinse canned beans or vegetables before eating them. Add flavor with lemon, garlic, herbs, onion, pepper, or spices instead of adding more salt. And be careful with healthy foods that are still salty, like certain soups, sauces, crackers, and ready-made meals. Also drink fluids in a steady, sensible way, unless your doctor has told you to limit fluids. Some people think drinking less water will fix swelling, but that is not always true. Dehydration can sometimes make the body hold on to fluid and can also cause dizziness, constipation, and kidney strain. If you have heart failure, kidney disease, or are on fluid restrictions, follow your doctor's plan. The next point surprises many people because the swelling may not be caused by food or age at all. It may be linked to a pill they take every day. The fourth common cause is medication side effects. Some medicines can cause swelling in the ankles or feet in some people. This can happen with certain blood pressure medicines, some pain medicines, steroids, hormone treatments, diabetes medicines, and some antidepressants. This does not mean the medicine is bad. It may be very important for your health. But swelling is something your doctor should know about. The most important rule is this: never stop a prescribed medicine on your own because your ankles are swollen. Stopping suddenly can be dangerous, especially with heart, blood pressure, diabetes, seizure, or blood-thinning medicines. Instead, write down when the swelling started, which ankle swells, whether it is both sides or one side, and whether it began after a new medicine or a dose change. Then bring that list to your doctor or pharmacist. This matters after 60 because many seniors take more than one medication. Sometimes 2 medicines together can increase fluid retention. Sometimes the dose may need adjusting. Sometimes the doctor may choose a different option, but that decision should be made safely. A simple home step is to keep a swelling diary for 1 week. Each evening, look at both ankles. Are they equal? Is one worse? Do your socks leave marks? Is the skin warm, red, painful, or shiny? Are you more short of breath than usual? Did the swelling happen after a certain meal, a long car ride, or a new pill? These details can help your doctor find the cause faster. Before we move to the 5th cause, listen carefully. If one leg suddenly becomes much more swollen than the other, especially with pain, warmth, redness, or tenderness in the calf, do not treat it like normal swelling. That can sometimes be a sign of a blood clot. A blood clot in the leg can become serious. Get medical help quickly, especially if you also have shortness of breath, chest pain, dizziness, or coughing blood. That is not a wait-and-see problem. Now, the 5th common cause is the one seniors should never ignore, because the ankles may be showing a problem somewhere deeper in the body. Swollen ankles can sometimes be linked to the heart, kidneys, liver, thyroid, or lymph system. The lymph system is a drainage system in the body that helps move extra fluid and waste. If it does not drain well, swelling can happen. The heart, kidneys, and liver also help control fluid balance. When one of these organs is under strain, fluid may collect in the legs, ankles, or feet. With heart-related swelling, you may notice swelling in both ankles, tiredness, shortness of breath, trouble breathing when lying flat, waking up breathless at night, fast weight gain over a few days, or needing extra pillows to sleep. This does not always mean heart failure, but these signs should be discussed with a doctor. With kidney-related swelling, you may notice puffy eyes, swelling in the legs, changes in urination, foamy urine, fatigue, or high blood pressure. The kidneys help remove extra fluid and salt from the body. When they are not working well, fluid can build up. With liver-related swelling, there may be swelling in the legs or belly, easy bruising, yellowing of the skin or eyes, loss of appetite, or unusual tiredness. With thyroid problems, swelling may come with feeling very cold, dry skin, constipation, weight changes, slow heart rate, or low energy. Please remember, swollen ankles do not automatically mean you have a serious disease. Many mild causes exist. But swelling that is new, getting worse, painful, one-sided, or linked with breathing problems should not be brushed off as just age. This is where many seniors make the mistake. They wait until the swelling becomes severe. They buy stronger socks, hide the swelling under pants, or stop walking because their legs feel heavy. But the safer path is to notice the pattern early and talk with a healthcare professional before it becomes harder to manage. Now let's talk about a simple home check you can do tonight. Sit down in good light and look at both ankles. Compare the left and right sides. Are they equal, or is one much bigger? Press one finger gently over the swollen area near the ankle bone for 5 seconds. When you lift your finger, does a dent stay there? That dent is often called pitting. It means fluid is sitting in the tissue. Then look at the skin. Is it normal color? Is it red, hot, shiny, cracked, or painful? Finally, think about your breathing. Are you more short of breath than usual? Are you breathless, lying flat? Did you gain several pounds in a few days without eating more? This simple check does not diagnose you, but it gives you useful information. If both ankles are mildly swollen after a long day and the swelling improves after leg elevation and movement, it may be less urgent. But if swelling is sudden, one-sided, painful, hot, red, or comes with chest pain, shortness of breath, fainting, confusion, or coughing blood, seek medical help right away. Now, what can you safely try at home if the swelling is mild, not sudden, and not linked with danger signs? Tonight, start with gentle elevation. Lie down or sit back comfortably and raise your legs on pillows so the feet are higher than the heart if you can. Stay there for 15 to 20 minutes. Do not place hard pressure behind the knees. Do not bend the knees sharply. The goal is comfort, not force. Then do gentle ankle pumps. Point your toes away slowly, then bring them back toward you slowly. Do this 10 to 20 times. Move only within a comfortable range. If you feel calf pain, chest pressure, dizziness, or shortness of breath, stop. Tomorrow, try the movement rule. Do not sit still for more than an hour without moving your feet or standing up if it is safe for you. If you use a cane, walker, or need help, stay safe and move with support. Even small movements can help. Ankle circles, heel raises, and short walks around the room may support circulation. At meals, look for hidden salt. You do not need a perfect diet. Start with one change. Choose one lower sodium meal. Replace one salty snack with fruit, yogurt, unsalted nuts if you can eat them safely, or another food your doctor allows. If you have kidney disease, diabetes, or other food restrictions, follow your personal plan. At night, check your socks and shoes. If your socks leave deep, painful grooves, choose looser socks. If your shoes feel tight by evening, do not force your feet into them because pressure can irritate the skin. Seniors need to protect the skin on the feet. Small cracks, blisters, or wounds can become bigger problems, especially for people with diabetes, poor circulation, or nerve problems. If you have diabetes, take foot swelling seriously. Check your feet every day for cuts, blisters, redness, warmth, drainage, or sores. If you cannot see the bottom of your feet, use a mirror or ask someone you trust. Do not ignore a wound that is not healing. Now let's clear up a common myth. Some people think swollen ankles mean they should take a water pill from someone else, drink special teas, or use strong home remedies to remove fluid. Please do not do that. Water pills, also called diuretics, can affect blood pressure, kidneys, sodium, potassium, and hydration. They should be used only with medical guidance. Herbal products can also interact with medicines. What seems natural can still be risky. Another myth is that compression socks are always safe. Compression socks may help some people, but they are not right for everyone. If you have poor blood flow in the arteries, severe foot pain, numbness, skin wounds, or very cold feet, compression can be unsafe without medical advice. Ask your doctor what level of compression is right for you before using tight stockings. The next part matters because swelling is not only about the ankles. It can affect walking, balance, skin health, sleep, and confidence. When ankles are swollen, shoes may rub. Walking may feel heavy. You may avoid activity. Less activity can make circulation weaker, which can lead to more swelling. This becomes a cycle. Gentle daily movement can help break that cycle, but it must be safe and steady. For the next 7 days, try this simple routine. In the morning, look at both ankles before you put on socks. Notice whether the swelling is gone or still there. During the day, move your ankles at least once every hour while awake. At lunch or dinner, choose one lower salt option. In the evening, raise your legs for 15 to 20 minutes. Before bed, write one sentence about the swelling. Better, worse, same, one side, both sides, painful, or not painful. After 7 days, you will have a clearer pattern. If the swelling improves with movement, elevation, and less salt, that is useful information. But if it keeps coming back, gets worse, or does not improve overnight, make an appointment with your doctor. Ask about your heart, kidneys, liver, thyroid, veins, medicines, and circulation. Your doctor may check your blood pressure, listen to your heart and lungs, examine your legs, review your medicines, or order blood tests, urine tests, or imaging if needed. And please pay attention to body weight. A sudden weight gain over a few days can sometimes mean the body is holding fluid. If you have been told you have heart failure or kidney disease, ask your doctor what amount of weight gain should trigger a call. Many people are given a personal number, such as a certain number of pounds in a few days. Follow your own medical plan. Now, let's make the 5 causes simple again. Swollen ankles after 60 may come from weak leg veins, long sitting or standing, too much hidden salt, medication side effects, or deeper problems involving the heart, kidneys, liver, thyroid, lymph system, infection, or a clot. Some are mild, some need treatment. The key is not panic. The key is pattern. Ask yourself these simple questions. Is it one ankle or both? Is it sudden or slow? Is there pain, redness, warmth, or fever? Does it improve overnight? Did it start after a new medicine? Do you feel short of breath? Are you more tired than usual? Are your shoes suddenly tight? Are there skin changes or wounds? These answers matter. Call emergency services right away if swollen ankles come with chest pain, trouble breathing, shortness of breath while lying down, fainting, coughing blood, sudden weakness on one side, sudden confusion, or severe pain. Get urgent medical care if one leg suddenly swells much more than the other, especially with calf pain, redness, warmth, or tenderness. Contact your doctor soon if swelling is new, getting worse, does not improve with elevation, keeps returning, or comes with fever, skin wounds, belly swelling, yellow eyes, changes in urination, or unexplained weight gain. This is not meant to scare you. It is meant to help you listen to your body sooner. Your ankles can be an early signal. They may be telling you that you sat too long. They may be telling you to reduce hidden salt. They may be telling you to ask about a medicine. Or they may be telling you that your heart, kidneys, veins, or circulation need attention. Tonight, do the simple check. Look at both ankles. Press gently for 5 seconds. Notice the skin. Think about your breathing. Raise your legs if it is safe. Move your ankles slowly. Write down what you see. Then use that information to make a smart decision. You do not need to guess. You do not need to panic. And you do not need to ignore it. Swollen ankles after 60 are common, but common does not always mean harmless. The safest approach is gentle habits, careful watching, and medical help when the signs are unusual, sudden, painful, or getting worse. Before you go, comment below and tell me this. Do your socks leave marks by evening? Do both ankles swell, or only one? And are you in your 60s, 70s, or 80s? Your comment may help another senior feel less alone. Subscribe to Dr. Wellness for more simple health habits for seniors, explained in plain English. In the next video, we'll talk about another common mistake many seniors make without realizing it.